Bismillahirrahmanirrahim. Assalamualaikum and a very good day to all. My name Ruhaya binti Salleh. Today I would like to present my publication finding entitled Factors Contributing to Food Insecurity Among Older Persons in Malaysia, finding from National Health and Morbidity Survey 2018. For the introduction, food insecurity among older persons occurs when people lack access to a sufficient quantity of affordable and nutritious food. And based on Food and Agriculture Organization FAO, define food security as when all people at all times have physical, social and economic access to sufficient, safe and nutritious food to meet their dietary needs and food preference for an active and healthy life. FAO estimated that 10.8% or 1 in every 9 people in the world were undernourished. Meanwhile, 700 million people or 9.2% of the world population were exposed to severe food insecurity. So based on a previous study conducted in Malaysia by Norlida et al. 2017, 27.7% of the elderly were facing food insecurity in Fedah Lebuk Merbau Kedah. The next study from Norfadila et al. 2017, 22.9% were facing food insecurity studies conducted in Mukim Panji, Kota Baru District of Kelantan. And the next study by Misbah et al. 2018, 19.5% of older adults were food insecure studied done in Petaling, Selangor. And the last study conducted by Zainuddin et al. 2017, 6.9% of prevalence of food insecurity was reported among older adults living in Klang Valley. So for the methodology of this paper, all individuals aged more than 60 years staying in the selected living quarters for at least 2 weeks were included in the survey. In total, 3,977 older persons were selected for this study. Data collection was done via face-to-face interview using mobile device with a structured questionnaire. The questionnaire was pre-tested and available in 2 languages, Malay and English. And for variable for this study, food insecurity status was determined at the individual level using the 6-item short form food security scale based on United States Department of Agriculture 2012. The classification of food insecurity was based on 3 categories. The first, high and marginal food security score based 0 to 1, low food security score 2 to 4, and very low food security score 5 to 6. The combination of low and very low food security was defined as food insecurity. So this account for the result for this publication. So based on the findings, 10.4% of the older person in Malaysia suffer from food insecurity. The prevalence was higher in rural, 19.1%, with no formal education, 20.4%, income below 1,000, 15.2%, elderly living alone, 15.6%, and unemployed older person, 10.5%, and low to fair social support, 18.7%. Further analysis using multivariate logistic regression for factors associated with food insecurity showed that older person for a rural area 2 times higher to get food insecurity, and based on highest education level, with older person with no formal education 8 times higher to get food insecurity, and primary school education 7 times higher, and secondary school education 4 times higher compared to tertiary education. And based on individual monthly income, older person income less than 1,000 5 times higher to get food insecurity, and income 1,000 until 1,999 2 times higher to get food insecurity. Based on malnutrition status, older person at risk of malnutrition or malnourished 1.99 times higher to get food insecurity compared to normal nutritional status, and based on social support, older person with low to fair social support 3 times higher to get food insecurity, and older person with high social support 1.65 times higher to get food insecurity. For the discussion and conclusion part, this study also reveals the illustration of food insecurity with lower income and education levels. Individuals from lower income groups were more likely to consume low quality food, particularly due to their financial inability to purchase healthy foods. This study also found that older persons without formal education tended to be food insecure, and this study similarly some studies found that education level was linked to expenditure on healthy diet. Another study stated that education influenced how older person manage their food quantity as well as their dietary quality. Furthermore, with the lower the education, were less likely to be employed in job sector that offered higher salary. According to the finding, malnutrition was associated with food insecurity among older persons. These findings are comparable with the studies conducted in Turkey and Greece, where older persons with food insecurity may lack the ability to purchase enough food or nutritious food, which could cause undernutrition if it occurs over a long period. The prevalence of food insecurity of 10.4% among older persons in Malaysia was slightly lower than that of the other developed countries. In addition, older persons from a rural area with a lower socio-economic status were significantly associated with food insecurity. Therefore, it is vital to understand the factors that contribute to poverty among older persons for better policy measures. With that, thank you very much.